Medical science is helping us to understand the powerful tools our bodies use to heal themselves. Now we're starting to learn how to harness some of those tools, and Dr. Bill Johnson of Innovations Medical is here to talk about their investigational work into cell therapy. Dr. Bill, how are you today?
Good morning.
This is something that you've been passionate about. We've been speaking about this for a few weeks now. So what exactly is cell therapy?
Well, cell therapy is the term that is being used for when we harvest some of the body's most powerful healing elements, namely growth factors and stem cells. We do it with just a little bit of liposuction. We're using your own cells. So we do a little local anesthesia and then take that fat that we remove under local anesthesia, process it a little bit, get the stem cells and growth factors out, and we call that product stromal vascular fraction, or SVF. Then we take the SVF and deploy it, all of that in the office in just about a couple hours.
That's so great. Let's even break it down further and talk about what makes these stem cells and growth factors so special.
Well, we have an animation to kind of show folks that if you injure your finger anytime or anywhere, if you break a bone or anything, first thing that happens is the damaged cells release growth factors. That increases blood flow to the area. White blood cells migrate in, and that's important because they take care of the damaged cells and any bacteria. And then what the white blood cells do is they release a large number of growth factors. And the growth factors that are released by the white blood cells activate stem cells, which can multiply. So there gets to be a lot of them, and they can become whatever we need. They can become the skin cells, the blood vessel cells, bone cells. So if it's a broken bone, a torn muscle, a cut in your finger, all of those things heal the same way. So what we're doing with cell therapy is we're just delivering more than your body can normally deliver to an injured area.
Okay, so you've been investigating SVF. What problems are you seeing, and what are you trying to work out?
Orthopedics is probably an area where we're seeing the very most deployments of people that need knee replacement, need hip replacement, doing very well with SVF injections. Folks that have had chronic injuries or muscle injuries that just won't heal well, those folks are doing very well.
Isn't that something? Those people who have been suffering with the knees and the hips, I mean, these are such common areas, are seeing relief that I'm sure surprises them and also medical professionals.
And with those, we deploy it both into the area and we do an IV deployment as well. So you get the stem cells put directly into the knee or directly into the hip.
Fantastic. Okay, what about other types of arthritis?
Well, rheumatoid arthritis and the other connective tissue diseases like lupus, like Crohn's disease, like scleroderma, all have protocols and are seeing good results. We're also doing disorders like fibromyalgia, myasthenia gravis. We're doing some neurologic conditions like neuropathy, doing some multiple sclerosis patients. One of the most exciting areas is ophthalmology. We're doing some macular degeneration and retinitis pigmentosa and seeing some good results. So it's really exciting.
There's so many different uses, and obviously this is such a breakthrough. So let's talk about the costs associated.
Yeah, that's a real important point because this is patient-funded research. This is investigational and it's patient-funded, so we do have to charge for the procedure.
Okay, and obviously, but those who have been suffering, and maybe this is a good option for them to investigate this.
It's a great option for folks that don't have another alternative. The conventional therapy just is not doing anything for them or there's nothing available yet. And it's a good option for those who are looking at a big deal in conventional therapy, like a joint replacement.
Okay, all right. Really good information, Dr. Bill Johnson. I know you are excited about this. This is a true breakthrough, and we're glad you brought it to GMT today.
Well, thank you.
Okay, here's the information you need to know. The Innovations Medical Stem Cell Center is 214-699-6948. Or log on to innovationstemcellcenter.com. And as always, you can email your questions to questions@innovationstemcellcenter.com.